But I want to start for the listener, the woman that is cycling, that does, like, she's in bed, she has the worst cramps, she's got headaches, like she's completely incapacitated basically for a portion of her cycle. What would you recommend?
I think the first is psychological. So what I notice both in myself and in the women that I've spoken to over many years is that we often will blame and shame ourselves into oblivion. It's like, oh, I'm broken. There's something wrong with me. What the hell? Why can't I get out of bed? Why does this hurt so much? Why can't I just punch through it? I'm not on the right, like the diet. Why can't I ever make any diet work? Why can't I ever follow any program to the end? So I would say the first is, wherever you are, you have a terrible menstrual cycle, you are debilitated with cramps, you're on Anaprox or whatever you're taking for pain medication. Just know that your body is just trying to talk to you, that's just your body's way of saying, hey, like, not all is well. That doesn't mean that it's permanent and forever. It just means right now.
Hey guys, welcome back. Thank you for joining us on another episode of the Ancient Health Podcast. We have an incredible doctor with us today. She's beautiful inside and out, but she is even more so knowledgeable about the female body. She's knowledgeable about a lot of things, actually, because she just taught me some things about my plants, which I was super grateful for because I do not have so much of a green thumb. But Dr. Stephanie Estima is an expert on female health. She has done a number of projects and work around educating women how to embrace their female bodies, their hormones, especially how to optimize their hormones. That's something we talk about a lot on the show. But she goes through this deep understanding that blends neuroscience with metabolism, nutrition, exercise physiology, kind of bringing all of these things together, which is all a picture of our health. All of these different components have to make sense and they have to work in a symphony. So I'm super excited to have her here today. So many of you have messaged me or expressed interest in learning about perimenopause, about your cycle, about all the different influences that impact your hormones and how you experience the transition of your hormones. So Dr. Stephanie Estima, thank you so much for joining us. I'm thrilled to have you on. I've been following your work for some time and I just love what you're doing. And I know this is going to be a great conversation.
I am delighted to be here. Thank you for having me.
So good. Well, I don't want to miss a beat. I don't want to waste a moment because you have so much value to offer us. But I would actually love to start off here because you have a very interesting story with your own hormones. And I think that a lot of women, whether you've already experienced, or maybe you're in the phase of where you're in your 20s, 30s, you're out there hustling and grinding, maybe you feel really good, but all of a sudden the wheels may start to fall off. And you may think like, okay, I was working out, I'm counting my macros, I'm doing all this stuff. And then whatever reason, it's like you were doing the same things, but it got to a certain point and everything started to work against you. And I know that there's a little bit of your own story in that. So can you share how you kind of got into the space of really being kind of in a hormone specific niche? Because I think that the story really is threaded through your work. And I love to hear how women have learned and overcome.
Sure. Yeah. I would say that for me, I've always been a student of, the neuromusculoskeletal system. That's my training. That's how I'm trained. So brain metabolism, muscles, bones, joints, tendons, all of that. So a lot of robust education in that realm, formal education. And personally, I struggled a lot with my own menstrual cycle. So to your point, I would work out and I would, eat what I thought was healthy. And I would try to do all of the things to sort of manage my lifestyle. And all through my professional schooling and even into when I was in private practice, I was maybe 2 weeks of the month, I would feel okay. And then I would have the week leading up to my period where I would feel really crabby. I would feel, water retention. I'd see mood changes, sleep changes. Didn't really feel good in my body. And then there was bleed week, right? So when I did eventually get my period, again, lots of cramping, lots of pain. I would have to medicate to sort of be able to deal with to be able to live, my activities of daily living. I really couldn't participate in them without the medication. I've never really thought formally about hormones. I mean, sure, I'm educated in, we have our, endocrinology lessons in school and all of that kind of thing, but I never really distinguished. And I think a lot of practitioners who get into the female space, I never really distinguished between men and women. It was always just sort of like, well, the only difference between us is that we have a reproductive system and we're a bit smaller. That's kind of like the only real distinction that I made. And, personally, I struggled every month, as I mentioned. So it really wasn't until I had a couple of, I'll say, catastrophic events happen in my personal life. So I had a fire in my clinic. My clinic actually burnt down. And at the time I was going through a divorce with my boys. My boys were young at the time. They were 5 and 3. And we were going through a divorce. So 2 very stressful events. So like my work is now, I had to, kind of scramble to find like a temporary space to continue practicing and seeing my patients. And then I was privately going through this, very difficult time. And I will say, my boy's father and I have a great relationship now, but we've worked very hard at it. But it doesn't matter how great it is now. Like at the time it was very stressful. So I had as a result, my menstrual cycle was even worse during those times. I took a summer vacation. I think maybe it was July. I took some time off of the clinic and I picked my boys up and we went to Italy for a couple of weeks. And in Italy, or, maybe when, a North American is vacationing in Europe, you tend to get a lot more steps. You're walking a lot more. We can make a comment on the agriculture and the food practices in Europe versus, in North America. I think they're very different. There's, the glyphosate and the wheat and all the things that, the wheat varieties that are used in North America are distinct and different from the ones that are approved in and used in Europe. My stress was much better. I was getting a lot of natural sunshine. I was enjoying time with my children, and towards the end of that vacation, ended up getting my period. We were there for about 3 weeks. So it was like the end of it. I ended up getting my period and it was wonderful. It was like easy. I didn't need my meds. I wasn't holed up in the hotel room with, like my sleeping mask on. And, it was lovely. And I've said this privately to friends, and I may have shared it on podcasts as well. Like I almost felt like I was like menstruating like a goddess, like it felt so beautiful. And so when I came back to Toronto, my home in Canada, I said, okay, so same body, right? So this body menstruated like a goddess in Europe. I can also do that here in North America. So kind of started my search, let's say, to figure out how I could feel that good again, and really looking at some of the patterns of the way that I was living, and to see such a short turnaround. It was only 3 weeks where I felt so amazing, and started in practice, was rebuilding the practice, was building out a rehab center and all that kind of stuff in the clinic. And we were running some nutrition programs there, and started to play with, eating and timing our food to coincide with our menstrual cycle, how exercise and even the rehab and the care that my female patients were getting, we were starting to tailor that to their menstrual cycle versus, our men, who are pretty consistent. If we look at it from a hormonal perspective, there's some circadian, variation, of course, higher testosterone in the morning, they have more estrogen in the afternoon. But pretty much same day to day, whereas females are very different over the course of a month, and day to day they can change quite a bit. So started playing with nutrition protocols, exercise protocols, stress protocols over the course of the menstrual cycle, and that really birthed my book. I'm writing a new book now, but my first book, called The Betty Body, which is basically how you can time your exercise, time your eating to coincide with your menstrual cycle if you are a cycling woman. My next book is going to be on perimenopause because, as you mentioned, lots and lots of questions. You can be eating the same calories and doing the exercises that you always did. And then, you're putting on fat in places that you've never put it on before. Your energy tanks, you don't feel like yourself. So I think that there is a special cohort, if you will, in that sort of 5 to 10, sometimes in some women 15 years, that transition into menopause. And I would really like to reframe it as not something to avoid, not something to fear, but to actually strategically put some of your ducks in a row so that as it's happening, you feel great. So right now, at the time of this recording, I'm 46 years old. My labs are pristine. I'm full on in perimenopause, right? So I should, be feeling terrible. If you sort of listen to conventional wisdom or the scare tactics that we see sometimes online, but I feel wonderful. And I have options, and I'm sure we'll talk about hormone therapies, but there are practices that I'm doing every day now to set myself up for success, and they're all lifestyle, modifiable factors that are in most cases pretty low cost and there's like a low barrier of entry for most people to be able to do these and do them consistently. So we can certainly talk about those as well if you'd like.
Oh man, this is incredible. And I have to point this out because I think this is so valuable and it's something that I'm learning right now. A lot of times when we're experiencing health challenges, we think, we can't let anything else change because if I travel, if I do anything differently, it's going to get worse. In our minds, we're hanging on, like white knuckle gripping all of the different habits that we have because we think, well, I was doing it before and it worked and now it's stopping. It's not working as effectively as it was before. So maybe if I just tighten everything up a little bit more, we don't give ourselves any margin for our bodies to let down and be able to adapt and to grow and to manage the stress. So we actually end up buckling down even harder, creating more stress on the body. And what you just said there is that you actually left and broke out of your normal rhythms and patterns. You broke out of the consistent patterns of stress and the triggers that were in your life because you experienced some really heavy stuff. Like that's a lot to happen in a short period of time. But in doing that, because I'm thinking, okay, you're traveling, like that's stressful. You got kids in tow. That's stressful. You're in another country. They're speaking other, like there's a lot that for a lot of people, they would be like, oh my gosh, I think if I was already feeling bad and then I had to do some big trip with my family, even though it sounds like it's a vacation, we all know when you're taking kids anywhere, it is not really.
You need a vacation from the vacation at the end of it.
Yeah. I went to my parents' house 3 hours away this weekend and I felt like I needed a whole other weekend just to recover
Right.
because it's like, it's just a lot. It's a lot. But here's the point I want to drive home for everybody listening. In you doing that, you were able to give your body margin. How quickly? 3 weeks is not a lot of time, guys. Like 3 weeks is so short, but all of a sudden you notice, like, boom, you change the habits. You got your body out of the rhythm that it was in. It was in like a stage of breakdown. And it sounds like you gave yourself runway and opportunity for the body to show up and start to re-regulate and heal. And even that's all it takes. That's the point I want everybody to realize, because you may think like, my symptoms are so bad and they've been this way for so long. It's probably going to take me 3 years to dig myself out of this pit. And it's going to take a lot of money and it's going to take a lot of resources and all of these things. And it can seem overwhelming. But what you just said there in your story is that by just changing the placement, by just adjusting what you were doing on a day-to-day basis. And I want to ask you this too, because I think this is important. When you came back, did you notice that things started to get worse again? Or were you able to maintain it? Because I think that that's kind of a really interesting take too, is to realize like, okay, well, maybe your body's on vacation. Yeah, it feels good. But did it come back? Were you able to recover some of the capacity by allowing your body to regulate? And then you were able to figure out, okay, now I know what works. I need to honor that and place emphasis on it so that I can sustain it for the future.
Yeah, that's exactly what I did. So it was really breaking down what are some of the things that I was doing here on vacation consistently over the course of the 3 weeks that really worked for me. So it was getting sunshine. It was going for walks after meals. It was, spending time with my kids in a meaningful way. It was sleeping, the appropriate amount of time. So I took some of those principles back home. Was I perfect? Absolutely not. Right. So that's the one thing I love about our menstrual cycles is they're kind of a report card, right? So at the end of the month, you sort of get your report card. How well were you at managing your stress? How well were you at managing your nutrition and nourishing your cells? And how well were you at your movement practices? So, were there months where I was worse again? Of course, but those were some of the tried and true principles that I really stuck with. There were a couple other things that I added in along the way and, started changing the way that I was eating in accordance with my menstrual cycle, changed the way that I was training. So those things sort of over time were layering on top of each other to make things better and better and better. Gosh, when it was like 2019, that whole scenario happened where I was in Italy and, oh, pardon me. No, it was earlier than that. It was 2000 and, oh my goodness, was it 2000? It was 2017. So coming back into and building out this clinic and all of that, it's been, several years since then. And I feel, and it's something that is sort of built on itself. It has its own, I've overcome that inertia, and now it has its own sort of, force. So every day I know that I have to get some kind of movement. It's usually a walk in the morning, like I did this morning. And there's usually some type of weightlifting. I'm always looking at my nutrition, principles have changed a little bit in my 40s. And especially now into my mid to late 40s, I'm certainly prioritizing protein a little bit more than I was before. But there are things that I've been doing consistently over several years now that are pretty, available to everyone, save for, you need to go for a walk in the morning. You need some trainers. You can go in flip flops. Everybody has something like that around. For the weight training, we'll talk a little bit about that, I'm sure, but, maybe a gym membership, but you can also modify, exercising at home and doing things like that. But I think that overall, when I came back from that trip, to sort of come back to your original question, it was, what are the things that really worked for me that are low cost, easy and simple, because I didn't have elaborate gyms in Italy. I mean, anyone that's ever traveled to Europe knows how difficult it is to find a gym because they don't have the same kind of gym culture that we do in North America. So it was really, what are some of the ways that I am attuning to my body's natural needs. So light, and sort of regulating that circadian rhythm, sleep. And that's of course a big part of stress management. And then movement, like walking after every meal, we would get up from the restaurant wherever we were eating, and then we would go walk. And so that was something that those were three of the big ones that I really brought home in terms of what are some things that can really move the needle for me. And then the other one, of course, is like meaningful interactions with my children. Not always like, here's the to-do list. Okay, we got to get up to do soccer, and like, okay, you got to make your bed. And did you do, like, those things still have to happen. Like, they still have to get to their soccer practice. They still have to eat healthy. I still have to make sure that they're making good choices in their life. But I also am carving out more time for, we call them, mom son date, like mommy sunny dates. So we'll go, just me and one-on-one with one of the children, and we'll go for a walk together. My older one now likes his, iced cap. It's so fancy, likes iced cappuccinos now. So we'll go somewhere where he can get his iced cap, and then I will probably get a coffee or a tea depending on the time of day. And then we go for a walk and we chat. And then my young one and I will do other activities. He likes to do, putting indoors. What's that called? When you do like golf indoors, like mini putt. That's we like to do that.
So fun.
Yeah. Mm-hmm.
I love that our kids give us opportunities to like go do things. We would never just go do that as an adult.
I know. I would never do mini putt as an adult, but he loves it. And there's one nearby that's like a glow in the dark one. So he really loves this particular place. So we go there. Our mommy sunny dates. That's what we do together.
That's so cute. I love doing that with my girls. We don't have those. I mean, I know we don't have one in Charleston, but I mean, we're close to Myrtle Beach. And if y'all know South Carolina, dirty Myrtle.
Yeah.
Well, Myrtle Beach, I mean, we got a lot of like miniature golf, but it's like, it is not what you just described. So anybody that is from the South that knows Myrtle, I mean, you'll just laugh.
There's an entrepreneurial opportunity. Anyone in Myrtle, you can open a glow in the dark mini putt.
Yes. Honestly, I mean, there you go. Somebody is living on the coast over here that can definitely capitalize on that. Cause Myrtle, I mean, yeah, anyway, I won't spend any more time on that, but this is so fascinating because you know what? It makes me think of the foundations that you're talking about, like getting daylight and having times for movement. Doesn't always have to be going in the gym. Like you just talked about gym culture in North America. I mean, it's like go to the gym, crush your soul, then go sit in a desk all
right.
day.
Yes,
like
exactly.
That is not, that really is not helping our bodies. Like we give ourselves 45 minutes of like absolute physical torture, but then we don't move the rest of the day and we sit in front of blue lights. And
God, that's such a great point. Yeah.
Yeah. It's just that's not, and like what you were saying, in Europe, like, yeah, they don't need to go to a gym because they're moving their bodies. They're probably doing physical work out in the yard. They're doing things that are requiring them to move and lift weights. And, whereas we are so sedentary, we have to just isolate a small fraction of our day into cramming everything in so that we can sit down and then not feel bad about it. But meanwhile, like metabolically, that's not how we were designed. So the foundations are so important, but getting the foundations in place affords you those places and the parts of your life that are the most important, which are the meaningful relationships. If you can't get the foundations down, you can't show up for the relationships in the way you want to because you don't feel good. Nobody wants to go do those things with your kids when you have brain fog and you got headaches and you're carrying all this extra weight and your body hurts. Like, it's not enjoyable. I mean, I know what that feels like, just being run down, and it puts you in a bad mood. I'm like, I can't enjoy anything right now because I'm in a funk. Like, mentally, I'm just not in a good place. So what you're saying is like, the foundations of our health are the most important, and they seem like simple concepts, but like, it's hard. It's easier said than done in a lot of ways because our culture here is not set up around the foundations. But what you're really trying to show, and what I hear you saying, is that in order for us to really capitalize, in order for us to experience the things that we desire the most, we have to figure out how to make this work for our lives. We do. And I love that first of all, the fact that you're 46, I'm like, how is that even possible? Because I'm looking at you on the screen and I'm like, she looks like she's 26. But you came from a background of having, like, sounds like very debilitating periods and cycles, like very uncomfortable, to now being in perimenopause and you feel your best. So give us the formula for a cycling woman. In order to get her cycles to feel good, what would you recommend that she do? That way she's set up for success in perimenopause and menopause. And we can kind of like break those segments up. But I want to start for the listener, the woman that is cycling, that does, like, she's in bed. She has the worst cramps. She's got headaches. Like, she's completely incapacitated basically for a portion of her cycle. What would you recommend?
I think the first is psychological. So what I notice both in myself and in the women that I've spoken to over many years is that we often will blame and shame ourselves into oblivion. It's like, oh, I'm broken. There's something wrong with me. What the hell? Why can't I get out of bed? Why does this hurt so much? Why can't I just punch through it? I'm not on the right, like the diet. Why can't I ever make any diet work? Why can't I ever follow any program to the end? So I would say the first is, wherever you are, you have a terrible menstrual cycle, you are debilitated with cramps, you're on Anaprox or whatever you're taking for pain medication. Just know that your body is just trying to talk to you, that's just your body's way of saying, hey, like, not all is well. That doesn't mean that it's permanent and forever. It just means right now. So some of the things that we've already talked about would be where I would start. So very gently. I find that often women, when we have the fasting conversation, people are like, oh, we talk about fasting for 12 hours. Okay, I'm going to go for 24, or, oh, we're going to exercise. Okay. Like you said, I am going to crush my soul. And then, so I just would love there to be some flexibility in thought and the way that we relate to ourselves in a much more loving and gentle manner. So if you are in a lot of pain, know that your body absolutely has the capacity to get better. You just have to give it the right tools, and your body knows what to do. So the sunshine that we talked about, very gently, you can just get up and do a lap around the block, or, if that's not possible, up and down the stairs of your apartment building or whatever after a meal. And then the biggest one I would say to start with is sleep hygiene. And I know, things like putting your phone away 1 to 2 hours before you go to bed, that is available to everybody, right? There's there is no cost associated with that other than maybe putting there's no cost. Actually, there's zero cost. You just put a timer on your phone, and the thing goes off at, 7:00, put my phone away. And then the phone shuts down. It goes and charges somewhere else other than your bedroom. Turning off the lights in the evening. If you are someone who wants to go to bed at 9:30, 10 o'clock, let's say, I love to go to bed at 9, by the way, that's my favorite time to go to sleep. If I have my hair up and my oils on and stuff and I'm done by 9, like, I have won the day, but whatever time you're going to bed, 2 hours before, we have no devices, and then the home is dark, right? So the overhead lights are off. Maybe you have some nightstands or some candles. I know that there's some people who even put red lights in, either in the lamps themselves.
Mhm.
What I typically will do is I will put night lights, like plug-in night lights on like just above the floorboard, so the light is coming from the floor rather than from above, just to dim, so that we don't trip down the stairs or anything like that. So those are some of the things that I would start with. So very gentle movement. And then the other thing I would probably look at is, and I often joke just with the sleep, when we are starting to have good sleep hygiene. So that's, a wind down routine. The bedroom itself should be cold, so for my Americans, that's like 65 to 68 ish. For anyone else using other metrics, that's like 15 to 18 degrees centigrade or 65 to 68 Fahrenheit. So cold. And then we also want it dark. So sleeping mask on, or just like all the lights on, blackout blinds. I use a sleeping mask because I have this motion sensor thing in my room, and it just is enough to annoy me. So I wear a sleep mask overnight. So cold and dark. And then you've also just prepped your body by getting away from the electronics. That in and of itself, I used to joke, and I'll still keep this joke because it's at least it's funny to me. If you have a good night's sleep for 7 days, that is the best diet that you could ever possibly hope to go on. You will drop inflammatory, you'll drop water weight. Your face is going to look very different. Your mood and your affect is going to, you are going to feel like you've had, some type of, makeover on like just sleep for 8 or 9 hours for a week. You'll feel like $1 million. So that's the first thing. And then we can start looking at the nutrition, right? So I would say to start is just kind of taking an estimation of what you're eating, just notice the little, and I call these like the little BLTs, like the bites, the licks, and the tastes, right? So like, where are your BLTs? Are you just like at 3:00 when your boys come home? This is me talking to myself. Are you just eating the little like bits of their snacks or lunch that they didn't eat? That adds up. That can be 300, 400 calories. If you're, just throw it away. If it's not for you, just throw it away. Or, maybe you have one of those composters that you can put it in, and like it'll be useful for your soil eventually, something like that. So I would say just looking at how you're consuming your food, and then particularly those BLTs, the bites, the licks, and the taste, because most of us don't count those when we're putting our stuff in our calorie counter app. We don't count the little bite of grilled cheese or the little piece of pizza that we took from our kids, or, the little mac and cheese or whatever it is. So those things are very important. I think as a perimenopausal woman, when we're thinking about macros, we do have to think about protein and prioritizing protein over other ones, over other macros, meaning over carbohydrates and over fats. Now, of course, carbohydrates and fats, we need them, but protein is something that we need specifically for a perimenopausal woman, because if you are not training, if you are not doing resistance work, resistance exercise, you will start to lose muscle mass at the rate of about 1% per year. So over the course of your 40s, right, over the course of that perimenopausal decade, you could lose up to 10% of your muscle mass, right, between the age of 40 and 50, which is a lot. And it will take you a lot to get that back if you can at all. So protein is one of the ways that you can preserve your muscle tissue. I would say, thinking about protein targets, we want to think about them separately from the rest of the diet. So sometimes when you look at the diet, for example, a ketogenic diet, and I've written about the ketogenic diet before, you might think, okay, 70% or 60% of your calories are coming from fats, and then 20 or 30% is coming from protein. And then, whatever the fill is, 10% or whatever it is for carbohydrates. For protein, you don't want to think about it as a percentage of the diet. You want to think about it as a gram target. So
Okay.
if you are, let's say you're 160 pounds, let's say, and you are looking to drop some weight, the first thing that you're going to do is you're going to say, okay, maybe I want to be 150 pounds. So you are going to, for every gram of ideal body weight, for every pound, I should say, of ideal body weight, you are going to take an equivalent amount in grams of protein. So if you want to be 150 pounds, you would take in 150 grams of protein. And then from there, we can do some simple math. I'm sorry, I'll do just really quick math here on my. So if you're taking 150 grams, you multiply that by 4. If I can do that off the top of my head, that's 600. So that's 600 calories, right? That's 600 calories worth of protein. And then you can just back in whatever your caloric intake. Let's say you're taking in 2,000 calories for the day. Now you've backed out 600 of those calories for protein, and then you can split the remaining. Is it 1,400?
1,400.
Yeah, 1,400. You can.
I'm the worst with math, so if you're going to rely on me, we're in trouble.
Yeah, you can back out the 1,400. You can back it out with whatever you want. You'd like more fat, have it more fat. You want more carbs, have it more carbs. Whatever. But the point is that you've met your protein target. You've decided the protein target first, and then you've backed in whatever else, and you can eat in the manner that you like. So this works for high fat, this works for keto, this works for, high carb, it works, it works for vegetarians, it works for all kinds of people, like all kinds of diets, right? It's sort of diet agnostic. It's like, just get the protein target in and then back in the carbs and fat after that. And I think that that's important because what we're doing, for, the nerds that are like, why is this even important? Why are you telling us to have more protein? Because what we're doing is we're sending a chemical signal, right? So the protein is going to be broken down into amino acids. One of those amino acids is leucine. It's an essential amino acid. We need to get that from the diet. And that is going to initiate a process called muscle protein synthesis, which is going to now create new muscle protein. So that is going to help from a chemical perspective to preserve your muscle tissue. Now, of course, from a mechanical perspective, you'll also stimulate the muscle to create new muscle tissue when you're lifting weights and you're breaking down the muscle tissue in the gym. But when we combine those two together, that chemical stimulus with the protein and the mechanical stimulus with resistance training, now we have a formula that is going to maintain our muscle mass in a time when your body tends to be more catabolic, when your body tends to want to break it down. You are going to be actually making it more anabolic than it is catabolic.
This is a great breakdown on protein. I had not thought about it that way, but it makes me think now that, the idea that we are just naturally going to lose muscle and your waistline's going to get bigger and your muscle's going to go down, that you actually can set yourself up to be building muscle and not losing it, which I imagine is, and Dr. Gabrielle Lyons talks a lot about this too, but like that plays a huge role in how you feel. Right? Like in how that affects your hormones and how it affects that transition, perimenopause, menopause, because a lot of time, like fat is estrogenic in nature. And so when we have, these pulses of hormones that are kind of like roller coasters, I imagine that you begin to feel the effects of that and they become more exacerbated. So even having more lean skeletal muscle can impact and influence your hormones. We don't even think about that. So I love the simplicity too of prioritizing protein. And I will tell you, I do this myself. That's the only macro I pay attention to. And the bites, licks, and tastes, that's like perfect because I was just thinking this morning as I was making my kids a smoothie. And so I had like the spoon with the almond butter and I'm like, I'll just lick it and I'll put that. And I was making their lunches and I was, but it's so easy to do. But again, like you are, even just having those little bites and the little licks and a little taste here and there, you're initiating a insulin response, and blood sugar is so important too, especially for hormones, because we become more inflamed. We become insulin resistant. So then we're in a fat storage kind of programming if we're not now conditioned to be insulin sensitive. So I think that paying attention to sleep, like you mentioned, so valuable. And honestly, I mean, is sleep, it's like, we all know we need to sleep more, but if you do the one thing you mentioned about getting rid of the technology, your sleep, there's no doubt. It's not even just that your sleep will improve, guys. Your overall well-being will be improved, because scrolling and looking at your phone at night literally puts in your mind the images of everything. And you are subconsciously becoming in agreement with the things that you're seeing. So you're in agreement now with, this person has this, or I don't have that, or I should buy this, or maybe I did buy that. Now, I'm just buying things I don't need. And now it's adding more financial stress. And so like, you have so much upside to just putting the phone away for a few hours. I don't even like the TV on at night because I'm like, I just feel better. I'm like, we don't even need that. Like, it's just, your sleep will improve, but it's even beyond your sleep. Like your mental health and your emotional health will improve in that one area. Like it translates to so many other areas of your waking hours. So prioritize that. That's so important. Now, this is so helpful, I feel like, for our cycling women. So we've kind of hit on nutrition. We've talked a little bit about training and movement. As we're going into perimenopause, what are the signs and symptoms that you feel like are red flags? Because there's a lot of confusion around this that I would love to clear up. Most women just expect, well, our cycles get really wonky. We start sweating out our clothes every single night. Like that's how we know we're in perimenopause, but that probably doesn't have to be the narrative we experience. So what is like a normal, like what's normal for changing hormones and what is indicative of abnormal or unbalanced hormones in that transition?
Sure. Great question. Yeah. I would say when we think about the hormones that change in perimenopause, the first one that we're going to start to see change is something called progesterone. So this is the hormone that comes in the second half of the cycle following ovulation. So you must ovulate in order to start producing progesterone. So progesterone, think of the name progestation. It's a pro-pregnancy hormone. When you're pregnant, progesterone goes through the roof. That's, one of the ways that we know that you're pregnant is we see like really, really high. There's HCG, but there's also progesterone levels are very high as well. And progesterone has some profound impacts on our mood, on our sleep, our body temperature, digestion. It affects the entire body. It helps to calm us down. So it tends to kind of chill us out a little bit. We tend to have really good sleep when progesterone is high, and specifically when progesterone is high relative to estrogen. So progesterone and estrogen are both present in the second half of the menstrual cycle. So in the first half of the cycle, you have bleed week, right, where there's no progesterone. Estrogen is also quite low. And then in the second half, the second week, once you stop bleeding, we see higher testosterone, higher estrogen. A lot of women really feel good in that week. Then we ovulate and then we move into the second half of the cycle. So you ovulate and now you start producing progesterone, and then estrogen also will come back as well. And so progesterone does a couple of interesting things. One is it actually down regulates estradiol. So it actually controls the amount of estrogen that we produce in the second half of the cycle via the estrogen receptor. So it actually downregulates the sensitivity of the estradiol receptor. And it also downregulates the production of estrogen. So progesterone's like, girl, we got this. It's like, thank you so much, estrogen, but we don't need too much of you in the second half of the cycle, because if you have too much of it, then this is what I suffered with for years. You'll hear a lot of people call it estrogen dominance. This is a bit of a incomplete. It's sort of like a layman's term, but basically if you've ever heard that term estrogen dominance, it basically means too much estrogen in the luteal phase in the second half of the cycle relative to progesterone. Okay. That's the kind of the important marker there. And what can happen is women will have very tender breasts, very moody. They'll hold a lot of water. Your rings, for example, you won't be able to, that's going to be like, you're going to be like, putting soap and olive oil to try and get them off because your joints are inflamed, that kind of thing. So it's very concurrent with some of the signs and symptoms that you might expect with PMS, right? So it's like very moody, sleep is disturbed, breasts are very tender, lots of water retention, all of that. So what we should see is a higher level of progesterone. In our mid to late 30s now, going into our 40s, we start to see this sort of progressive decline in progesterone. Okay. So what can happen for a woman in her early, at least to mid 40s, is we can see almost like raging PMS, right? Because now we have this lowered progesterone environment. We have too much estrogen relative to progesterone. Okay. Even though we see estrogen also is declining, it's going to be, at least in the second half of the cycle, it can dominate, right? So this is where we get the acne, the breast tenderness, all the things that I've just described. You can feel like a teenager again. So if you had really bad PMS, when you were 16, 17, 18, 19, it may feel like a revisit to that. And it may feel, very cruel and unfair. What ends up happening in the second half as we start to see, so progesterone's coming down now, estrogen estradiol and estrogens are coming down, is now we actually flip the script, where now instead of being high estrogen in the second half, now everything is low. Now it's like estradiol is low, progesterone is low, testosterone's kind of been also stepping down as well. And this is where a lot of the women, to your point, are like, I feel tired. I don't feel like myself. I feel like I used to walk into the room and I used to be able to make decisions and I was confident. And now I'm just an anxious mess. I don't know who I am. I'm having feels like a midlife, quote, I'm using air quotes if you're listening, like a midlife crisis, because you just don't feel like yourself anymore.
Yeah.
So there are a lot of options that you can have. We've been talking about some of the ways that you can naturally improve. So looking at your protein, you touched on muscle, and we were talking about protein as a means to chemically induce, muscle protein synthesis. And Gabrielle talks about this as well, and she's a good friend of mine. But muscle really, when I think about muscle, it serves three functions. Obviously, it serves a mobility function, which you may not be thinking about in your 40s, but you sure as heck will be thinking about it in your 70s and your 80s, right? So we want to be able to preserve the joint integrity, tendon integrity, the muscle integrity, the proprioception, all of that. So it serves a mobile function. It serves a metabolic function, which you mentioned insulin resistance. So muscle is the biggest glucose sink in the body. It is the biggest agent to be able to dispose of glucose in the body. And then the third, which is less talked about, but I like to talk about it, is menstrual, right? So we have three M's, right? Mobility, metabolic, and menstrual. So when you are working out, particularly anabolic activities, I'll say long-term adaptations that are anabolic, like resistance training and sprints and HIIT training and that kind of thing, we are going to see it has a balancing of, it increases your testosterone naturally, because the more lean tissue, more muscle mass you have, the more testosterone is required to maintain it. But it's also going to help with that P to E balance, that progesterone to estrogen balance. So that can also really help you in perimenopause feel really great. So those are some of the changes that a lot of women will experience. First, it's like lowered progesterone. So like maybe the sleep is off, maybe they're a bit more moody. They might get that, initial kind of, like I call it, raging PMS, where the estrogen is too high relative to the progesterone in the luteal phase of the cycle. And then as we are kind of like late 40s, early 50s, everything is kind of low, where now a woman is just generally feeling terrible. So the weight training and the nutrition are important. Stress management we haven't talked about yet, but I'll throw in stress management in there. And then the other thing that I would say, which I'm glad to see there's more conversation around, is menopause hormone therapy, right? So hormonal replacement therapy as an option to replace some of those waning hormones that we are starting to see naturally decline. And it seems like the literature suggests that when you combine the hormone therapy with a mastery of the nutrition and the weight training and the stress management, your experience of perimenopause and menopause is going to be much better compared to if you don't do any, you're not getting the morning sunlight and the movement, and you're not prioritizing protein, and you're not on the therapy. Your experience can be markedly different. So, yeah.
That's so good. I want to ask this too. For the hormone replacement therapy, I do see a lot of women that will start with progesterone, like the ones that are in that like early season, early perimenopause, where the progesterone, like you said, is starting to dip faster than the estrogens. And with that misalignment, the mood disorders, like just feeling kind of like I'm coming out of my skin, like I do not understand, my sleep's terrible. So I see a lot of women start there. And then I see that women as they're getting in the menopause years, are doing compounded, estrogen, progesterone, testosterone. They're giving their body a lot more of what's completely absent or very, very minimal at that point in time. Is that kind of like, is that the picture of what you feel like is like a good application of hormone replacement therapy?
I mean, certainly you're going to have anyone who's listening, like, please have this conversation with your primary care provider. Yeah. But what you've described is a very common pathway. So we often will start off with progesterone. That's the gateway drug, right? So starting off with progesterone, if you're still cycling and you can kind of pinpoint where you are, then typically you'll start cycling progesterone like day 14 to 28. Let's say of your cycle, you start taking it to supplement in the luteal phase. If you don't know where you are in your cycle, then the recommendation, there's no standard of care, but generally the recommendation is going to be then just take it all month long, right? Because we don't know where you are. So just get the benefits of progesterone all month long. And then as you are starting to see those low estradiol symptoms, then we start adding in the estradiol and the progesterone together, and that can be patches, that can be, usually progesterone is taken orally. It is a pretty big molecule, so like the cream, it's not as effective as a cream, so we often see like oral micronized progesterone as the sort of standard of care. And then you'll start to see things like patches and other sort of compounds that you might orally as well. You'll see estradiol and progesterone taken that way too. So we see progesterone first, then we see estrogen added on later on, and then maybe TRT as well, so testosterone replacement therapy. I will just say that there is no current product available in the US or Canada that is a testosterone product just for women, which is a whole conversation unto itself around female healthcare and how we've grossly underserved our beautiful women for a long time. But what you'll often find is that there's off-label. So a lot of practitioners will use the TRT, like the products that are available for men, and then just titrate it down to an appropriate dosage for women. So you'll see that's sort of how we're getting around it and serving our patients.
Okay. That's really good to point out. And I'm glad that we're talking about kind of like the just different, like you said, it's a pathway to balancing, helping support hormones during transition, but you want to be testing them so that because just because your perimenopause doesn't mean you'll have the right, progesterone and you could actually make things, you may feel a lot worse. So just don't go into it blindly, like work with somebody that can look at from a more functional perspective of hormones. Because then you'll be able to capture, and you'll want to do that routinely. Like you want to do that, whether it's
every 6 months, baby. You should be looking at your labs especially if you're on HRT, you should be looking every 6 months. Because there are some people, I've seen some women who go on progesterone that actually don't do well with it. Most women, it's fine. But there's just like a subset of females that they gain weight, they're very sensitive, they become more moody, so it's not a one size fits all. I think for most women, it really does serve, the need and fills the need that is required there. But we also always want to be accounting for the bio-individuality of the individual. You may just, for whatever reason, progesterone just may not work for you,
That's a great point. Do you like blood testing for hormones, or are you on the fan of saliva or urine or any of the other?
You can. No, I do like, the Dutch test. I do like, looking at salivary cortisol and that and whatnot. But I think blood is, especially if you can especially if you kind of have a general idea of where you are in your cycle. If you're a cycling woman, there are certain times, let's say you don't test your progesterone in the first 2 weeks of your cycle because there's none, right? So the level that you're going to get back is going to be it's going to be falsely low. So if you're a woman where you kind of generally know your cycle's about, let's say 28 or 29 days, let's say, you want to be testing progesterone day 21, day 22, right? You want to be looking at the FSH and LH. So we haven't talked about these hormones yet, but follicular stimulating hormone, luteinizing hormone, you want to be looking at that day 2, maybe maximally day 3 of your cycle. So when you start bleed week, you want to get in and look there, because that's also, when we look at FSH, this is also, it's a very good, the level of FSH is a very good indication on how your brain is talking to your ovaries. It's sort of that pituitary gonadal, we'll say, axis or ovarian axis. If your FSH levels are very high, it's almost like your brain is like yelling at the ovaries to get something started, right? And they're just like they're not kind of doing the thing that they should be. So it's nice to also look certain times of the month to kind of look at levels. If you have no idea where you are in your cycle, it's been irregular. Some months you get it, some months you don't. Or sometimes you've had 2 periods in a month. Just take the blood work, like get the blood work whenever, because at that point you're not necessarily following a cycle, you're not following a rhythm anymore. So we just kind of want to get a picture of where you are. But I love, my general recommendation is a minimum of, or maybe a maximum if you're, I don't think you need to do it more than every 6 months. I think like every 6 months you should be getting a fresh panel.
Okay, that's really good to know. And yeah, I've had a couple clients I've worked with in the past, and very similar. Like their cycles were just so irregular, and it was hard to time it, and they were feeling terrible. And we did the cycle map from Dutch or from
Yeah.
Precision Analytical, and that
Mhm.
one's helpful because so it's an option too because it has you doing urine testing like several different weeks, different points throughout. So you kind of get to see like, where the blips are, like the ups and the downs and the ups and the downs, because it's hard. It can be really hard. But like you said, I think that if you're doing hormone replacement therapy, you for sure want to be testing to make sure that you're on the mark, because your body is changing and your approach to managing your body needs to be able to change with it. Otherwise, you'll end up feeling not well, and then you'll be going in thinking, we've definitely missed the mark and we want to
Yeah.
avoid that at all costs. So,
Yeah.
well, I want to hit on one more thing here because we haven't talked about menopause, and you mentioned stress management. And so I'm wondering where this fits in for our menopausal woman that's listening. What's the biggest piece of advice? What's the most important piece of being able to navigate that season for your hormones? Do you feel like, is it stress? Is it nutrition? I mean, I know everything has a place, but what do you feel like in your clinical experience is the one pillar of the most value for women hormonally in that season?
Oh, my goodness, I have to choose. Okay, so I was,
You can rank them. I won't make you choose.
No, I mean, I do. I am really a big fan of movement. It is something that I feel is such a gift. We are designed to move. Um, but to your point around stress management, and that's why I started off, when you were asking me, what's it one or two things? I said, well, it should be first psychological. Like we first should not want to just punch ourselves for feeling off, right? Like we don't want to be so hard on ourselves. And I think that the stress management piece, it's so intangible in a sense to be like, just manage your stress, like just, chill or, whatever.
Yeah.
So it can feel a little trite, but I can tell you that when you are sleeping well, when you're moving, your resilience does improve. Your ability to take on new stress or to deal with current stressors, your resolve and your resilience is improved. And I'll say that for a menopausal woman, and it starts also in perimenopause, there is a unique sort of set of stressors that these women will encounter. And I often call it the stress sandwich, right? So it's like the pressure from above or the stress from above and the stress from below. So the stress from above is sort of watching your parents age. Maybe your parents are now needing more support. They need to, you need to sort out their medications or take them to their doctor's appointments, or you're just watching them age and in some cases, unfortunately, deteriorate. So there's a grieving and there's sort of time commitments and there's that stressor that women who are typically the natural caregivers in the family are often tasked with helping take care of their parents if they're requiring assistance. And then of course we have our teenagers, right? So we were talking before the show, you have a 11-year-old, a 12-year, a 11-year-old and 10-year-old. I have a 13-year-old and 11-year-old. So now we have these teenagers who are stressors unto themselves. Like I kind of joke and say, like, I remember the diaper changing days and I remember how sleep deprived I was. I was like, God, it can't get any harder than this. And then of course, now I have a teenager who miraculously knows more in his 13 years than I have accrued in my 46, right? He just knows everything and I'm a dummy, right? So it's sort of like you have these teenagers now where you have to hope that the moral compass has been installed properly, that the software is running appropriately, and that they're going to be able to navigate, the new social situations and dating and all the things that kind of come with their teenage years. So you're sort of in the middle of this like stress sandwich. You have parents, you have kids, and you're trying to kind of navigate both of those things. And then your own body feels like it's changing. So it just can feel a little frenetic and chaotic.
Yeah.
The way that I have found the stress management most effective is through movement. So, and that's just me. So I can't speak for every woman because there's going to be some women who are like, meditation changed my life, or, yoga changed, first. And actually yoga is fantastic for stress management. I do yoga and I always feel high after I do yoga. So, I'll say, finding something that works for you to help with your stress. morning walk, like we've been talking about, prioritizing your sleep, making time for you. I don't know if we were recording, but I said, if I'm in bed around 9 o'clock, I have like my oils on my face. Like it takes me about, like I take off my makeup, I put my creams on, put my oils on, put my hair up in my little thing. That's like my time, right? I feel really special and I feel really important that I've carved out that 20 minutes that it takes me to take my makeup off and put my hair up and stuff. I feel really special, and I've carved that time out for me because I think that I am worth investing in that. So find the thing that makes you feel good. It can be as simple as, taking your makeup off at the end of the night. It can be an elaborate yoga routine, Pilates, weight training, whatever it is. I think that really doubling down on stress, if we have not mastered it in our 20s and 30s, we've just sort of learned to deal with it. It is something that we do and should address in our 40s and 50s, because it is a unique, stressful time. And then if you don't learn how to manage your stress, this is a life skill, right? So it's not going to get any easier when you're 60 or 70 or 80. We want to be able to deal with problems and understand what our capacity is for problem solving ability. Can we take the problem on at the time? Do we need to engage in help? Can we ask for help? What's our social circle like? All that kind of stuff. So I know that that's a bit of a long-winded answer, Courtney, but that's how I would answer that stress management question in perimenopause.
I think that that's such a good way to kind of wrap up, and just it really, the stress piece can't be overstated. And I love that you even said like your nighttime routine, because I was telling the girls one time, they just kept coming in my bathroom when I would like be doing my whole routine, and I was like, I love you guys, but you can't be in here right now, because
but it's gua sha time. Please leave.
I was like, I'm like, I just want to be in my bathroom alone. And like, they just kind of looked at me, and I was like, listen, I love y'all, but this little self-care practice, give me 8 minutes. Mom, this is my time. Yeah. But it is so important. And all of these little things add up. And truthfully, like growth, guys, it looks different. So you're going to like, don't resist it, even if it hurts. I mean, anytime we have a pruning in life, or we're moving into something new, like we're leaving things behind, there's always an uncomfortable nature, but we can't stay the same. And so if we can even shift, like you said, just the mental perspective of these different seasons, it's going to give you freedom. Like it allows you to experience healing. But if we're always in this mindset of, well, we just want to go back to what we knew was familiar because back then, or in that season, it worked back then, it felt good. You're always going to resent the change into something different. Even if it has its silver linings, even if it has sweet spots, you'll never be able to appreciate them because mentally you only see the success in the season that you experienced before. So allowing your body to adapt and to change and just growing, like we age, just because you add another year to the calendar doesn't mean that you're emotionally growing or maturing or experiencing wisdom. And I think that that's so important to state, is that like we need to be able to be uncomfortable for short periods of time so that we can experience the fruit and the fullness of the next season. And I love that we talked about all the different pieces that are practical, the nutrition, the getting in the sunlight, the little mindless snacking on your kids' food. Like, but there's so much here. It's blessed me for sure. And I feel like it's reinforcing a lot of things that I'm trying to learn myself. So Dr. Estima, I love so much of what you're doing. Guys, if you don't listen to her podcast, it's called Better. It's so good. She has incredible guests, but she's also very good at communicating and speaking on her own, which you do a lot of great little solo episodes in there too. So is there anything else you'd like to leave our audience with? Anything about what you're doing, what you're working on? We talked a little bit about your book, The Betty Body. You do have a new book that's coming out, but share with us, with our audience, a little bit more about where you're at right now. Any little final tidbits you want to communicate to them?
Oh, thank you so much. Yeah, I would say that the final piece that I would kind of leave anybody with is that your body is infinitely more wise than sometimes your mind. So, we always have the algorithms and here's the linear thinking that we're going to, and your body is just so infinite in her wisdom. So, listen to your body when she's talking to you through symptoms. You're not broken. You're just bent, like the Pink song, right? It's like, you're not broken. You just bent a little bit. And you can always straight out a bent, right? You can always straight out that little dent. So that's what I would say. in terms of finding more about me and, where you might find me to your, the Better Podcast, favorite part of my job. I started it after I actually closed the clinic. It's become the main part of my work is interviewing thought leaders and doing the solo episodes, as you mentioned. And you can find me if you want to interact with me. I'm on Instagram at Dr. First name, last name, Dr. Stephanie Estima. And then you can find me at drstephanieestima.com. We have a newsletter. We call it the mini pause, which is our little fun take on the word menopause. So the little mini pause is like a weekly topic. It goes out every Saturday. And there's, there's action items in terms of, so this week we talked about creatine. So what are the big things about creatine? Why do women in perimenopause want to be thinking about creatine? How do you take it? When should you take it? All that kind of stuff. So, you can sign up for the newsletter at drstephanieestima.com. And then we're just happy to interact with you in any way that you want. So there's lots of free ways to do it. Find me on Instagram, the mini pause newsletter on my website. And then when the new book is out, I don't have a name for it yet, but it is going to be about women in perimenopause.
So good. I'm excited about that newsletter because I love creatine. And I think a lot of women get a little nervous, using it.
There's a lot of misconceptions about creatine. It's like, oh, is your hair going to fall out? You're going to get bloated. It's like, all right, we just break down the science. For those of you that have no patience about the science, we give you the summary at the top. And then for those nerds that want to continue reading, the nerdy stuff is underneath that. So if you want just tell me what to do, it's right at the top. And then for those of you that kind of want more mechanisms, more science, you want to read the references, is all underneath that.
Oh, that's brilliant. It's so smart. It's like carpool line. You need the nuts and bolts. Here you go. We're going to give it to you. And then, when you got more downtime and you're not running around, you can unpack a little bit more. So yeah, definitely sign up for that, guys. I'm so interested in that too. And I love that you are really nourishing, like you're nourishing your household by living what you teach and preach, but there's a lot of overflow. And so we're able to experience that. And I'm just grateful for your time today. Thank you so much for sharing with us. Guys, if you are looking for any of those links to her website, her podcast, books, social media handle, all of that will be in the show notes for you. Thank you so much for joining us on today's episode, and we will see you on the next one.